So here's a shocker for you. Surgery is personal. Everyone in this room has either had an operation, has a friend who's had an operation, a loved one, a family member. Surgery is personal. What you may not know is that as I look at all of you tonight, you all look like snowflakes to me. Now, it's not that you're going to melt, but you're all different. Those differences are important to you. You want me to know about them, and these differences are important to me. Because if I don't take these differences into account, something catastrophic could happen. Now, we've talked about population health, evidence-based medicine, cookbook medicine, protocol medicine, but at the end of the day, you want this to be about you. When you're in my office, you're on my operating table, it's one-on-one. You want it to be about you. So I think we should use technology to look at the gaps where we don't do as well as we could and make it more about you. So when he walked out onto the stage, for me, this was magic. The future is here. He told us that everyone would be wearing Google Glass. Celebrities, movie stars, politicians, people would even come back from the dead to wear Google Glass. And there's no reason why our pets couldn't get in on it too. That was the promise. Except for we know it didn't happen. I owned a pair of glass. I didn't even wear it. And this isn't any different than what happened in healthcare. There were sound bites, TV spots, doctors walking around the emergency rooms with glass, the chart in your face, surgeons in the operating room getting minute-by-minute vital signs, live telecoaching, and the problem is it just didn't make a difference. It's kind of a bummer. So I was disappointed, being a video guy and a technology guy, but I got a little insight when a medical student who decided to take 2 years off from school to start a company with her sister, a little company called Remedy. We're not involved personally or financially. And she said, I want to talk about glass and surgery. And I thought this would be a great opportunity to do something different. I didn't want a soundbite, didn't want a news flash. I wanted something real. So instead of thinking outside the box, I saw this as an opportunity to go through a very clever exercise called thinking inside the box. And if you want to be an innovator, this is a great read, something for you to think about. So it's a two-part exercise that we'll do together. What would you do with a device, this is part one, that is hands-free, imminently portable, can send images and information to the internet? That's part one. Part two is, what would you do to strip out of the device? What would you take out of this kind of device to make it even better for our purpose? So we stripped out all the social media. We hacked the glass and took it all out. Hospitals, they're like snowflakes too. They're all different. Some are big, some are small, some have lots of resources, some have minimal resources. Some have experts sleeping in the hospital 24 hours a day for your beck and call. But I can tell you that most of the hospitals around the country and around the world don't have that luxury. Not enough experts, not enough money. So we need to have ways using technology to bring the experts and the patients closer together. So here's how it might work. Here's a sample, and then I'll show you the real thing. This is Dr. Ted. He's got a problem. He's not sure what to do with baby Jane. He needs an expert. He calls Dr. Phil, but he's at another hospital and can't come right away. And they start talking about the patient, age, vital signs. But here's the subtext that you don't know about. Dr. Ted, he's thinking, I really am not sure what's going on here. And Dr. Phil's going, I really wish I could see the patient, not just hear about the patient. And this maybe is where wearables come in, glass and all its cousins. So think about this for a second. There are a lot of opportunities to change healthcare. So let me show you what we did. We brought experts to the table by bringing them closer. Now, experts are important. Why? Because it takes 10,000 hours of deliberate practice to master just about anything. This is the work of K. Anders Ericsson, made popular by Malcolm Gladwell. Point two, experts use something called thin slicing, described in his other book, that they can just take an image of you. If we could just see you, even for a moment, we can make your care better. Experts read micro expressions. The look on your face when I tell you something good or bad. The look on your face and the way you react when I touch you in physical examination. It's better than telephone, it's better than pictures, it's better than just data. Taken all together, we get to make better decisions. So here's our study. We did a research study. We wanted to measure something. Remember, I was disappointed we couldn't measure anything better in the sound bites. So we had 3 hospitals, 2 of which are staffed by physician's assistants on the front line, and they're terrific. But they're not experts, they're not surgeons. So we had them examine the patient wearing Google Glass during the important part of the examination. They then took that image and shot it up to the internet. HD video, one of the capabilities of Google Glass. And we'll get back to that video. They then got on the phone, tracked down the surgeon, and the surgeon has basically 3 decisions to make. 1, send you home. 2, bring you to the hospital. Or 3, because we're the surgeons, to operate on you right then and there. So the surgeon made his decision, and he or she then got on the computer. Well, we could do this on a smartphone, we could do this on a tablet, and logged in the decision. Then they get to see the video. And we analyzed what happened to the decision making. What happens when we bring the expert a little bit closer to the patient? Well, let me show you what it looked like. So this is a real thing from our study, and you learn a couple things. Number 1, you don't need a lot of video. I could tell in under 20 seconds that this nice lady does not need an emergency operation in the middle of the night. Something that I might not have been sure about over the phone.
Okay.
That's really important.
Okay. Bueno.
But did it make a difference? Well, here's the number. 24% of the time, the decision-making changed. That's a gigantic number. Even more impressive, 10% of the time, that change involved the operating room. Either to go to the operating room or to maybe not go to the operating room in the middle of the night, because I can tell you nobody wants surgery in the middle of the night. Now, if you think these aren't big numbers, multiply it times the number of hospitals, the number of patients, the number of ERs, and soon you're talking worldwide impact, moving the needle, better patient care, and a lot of money saved. Now, I know what you're thinking. I could do this with my smartphone. And your phone is great for taking pictures of the Taj Mahal. But imagine you're sick. Imagine you're laying on a stretcher and you don't feel well. And the last thing you want is to whip out my cell phone and stick it in your face. I know I wouldn't want that, because I'm worried about all the other things that might be on this phone. We need devices made for medicine. Now, we're the surgeons, we did surgery, but there's a lot of other applications where you could see this being very handy. What about geriatricians getting messages from their nurses, their PAs, out in the field for elderly patients, wondering whether they should bring them into the hospital or the emergency room? It's the same thin slicing. If I could only see your face. What about really scarce specialists like hand surgeons? If I could only see the hand, I would know how to make the best decision when I can't be there in person. What about the visiting nurses, calling doctors, wondering whether they should send the patient in for a re-examination? And we all know how quickly we're trying to get people out of the hospital. Well, what do we do when they have a problem? And I can't see you. So for our research study, we made the images go away. We took a page out of Snapchat and made all the images go away except for the one that I de-identified so I could show you, because we didn't want protected health information preserved in our research study. But I'm telling you we should save those videos. I'm telling you that the information in these videos is valuable to me, and what I'm going to show you in a moment is that it's even more valuable to you. We need a last mile solution to record your care and put it in the chart. Well, what do we do today? We have an interview, I write down notes, it's got my biases, maybe I didn't hear you correctly, and it's all interpretation. The fact that it's digital doesn't change the fact that it's an interpretation. We should record it, and we shouldn't be afraid of it. It might make us better. Let's see. So here's an interview. Imagine I'm the patient now, and I'm looking at my doctor, and she's telling me about an important operation.
And you'll be asleep the whole time.
And I can record it. Now, what do we do today? Anybody know what this is? It's a surgical consent. Anybody here sign one ever? Yeah. If the job of this document is to prove that you're well informed, it's bad. It doesn't prove anything. In fact, studies have shown that even if you thought I did a good job doing it this way, your retention could be as low as 15% of the total information. That's horrible. It's horrible for you because you really need to know this stuff. It's really not good for me either because I am better served with a well-informed patient making the best decisions they can about how they want to take risk. What I think we should do is record this. It should go in the chart. And so the consent discussion of the future should look something more at the end like this.
To tell them that when you get home and your wife or your spouse asks you a question about what happened, I want you to go and tell your wife that you can always go back and look at this on your health record online. So you can watch this video of our interaction, and hopefully that'll get a lot of the questions answered.
Questions answered. When you're having surgery and somebody's going to tell you something catastrophic, something life-changing, I'm talking, but I know that many of you have other things going on and can't take it all in. Now, it's personal for me too. I have a friend, underwent major surgery. I helped him navigate through the system, and he went and saw lots of doctors. He went and saw lots of surgeons, for that matter. And we'd get on the phone, and he said about the website and a book and this and that, but I always went back to the same thing. What did the doctor say? That's one of the biggest questions in all of healthcare. Right now, every city, every town, every state, people want to know, what did the doctor say? We could do it today. No new science, no new technology, just plugging what we already have and making it work for you. Have you had one of those conversations with your child, your brother, your friend, your spouse, your parents? What did the doctor say? We could fix this tomorrow. We could revolutionize certain aspects of our healthcare system, dramatically change the way we think about our doctors. If you went and saw somebody who did a really so-so job of explaining surgery to your mom, it's not somebody you might want to go to. It would make us all better. So, whether we put the glass on you or put the glass on me, I think we can add great clarity to your care. We could do better than what we're doing tomorrow. Because if a picture is worth 1,000 words, I promise you there'll be days when a video would be priceless. Thank you.